So in the comment of one of my other videos, I had a request to analyze the Matinas Biopharma MTNB. This is the stock symbol. So I collected some of the data and some of my own experience with some of the similar other companies, and I'm trying to come up with basically more of a financial angle rather than its medical angle. But I will touch upon those subjects as well. So basically, the stock was trading when I last saw on 821 at 83 cents. So it is a penny stock, obviously, and the market capitalization is $165 million. So it's a very small cap, and therefore it presents a potentially big opportunity from here onward. But this sector, medical sectors like this, they are obviously risky in the sense that their potential depends upon the approval of the FDA, which may or may not happen, and then the similar other drugs they could claim kind of similar IP and things like that. But given that, after all the analysis, to give you a very broad view, it looks promising and a risk worth taking. What I looked at is that they have like they're spending very frugally. They have like only $5.7 million of expense every single quarter. They don't have any revenue as of now, but that jumps suddenly the moment they get the approval, FDA approval for some of their drugs. Uh, the one key thing is that they say that they have $68 million in cash, which means they can go for a long time to come with that low expense. Their expense is to really like 20 to $25 million every year. They have at least 3 years of cash in hand. They can continue their R&D, their administration, and then FDA testing, and so on and so forth. They raised some of the money by selling their stocks at $1.55 for $46 million. That's one good point. So obviously you are getting the stocks at a reduced price compared to whoever investors they invested at double that price. So that's one good point. They reached a maximum valuation $3.74 in February 17th, and then $2.27 more than 1.5 years ago in December 19. On the lower side, you have it went all the way down to 35 cents in July 18. So that you can think of that we can at least in the near term till it gets exhausted with the cash, or which will not happen like next 3 years. This 83 cents can jump all the way down to 35 cents, and if they do not get any approval or any drug into the market by the time they exhaust cash, that's a potential risk for filing for bankruptcy that they could find out. So given all those financial background and everything, that's what I could find. Let's move on to their key medicines and the key products that, and let's see what the potential we are looking at. What they say is that they have a lipid nanocrystal technology. It's a nanotechnology where you can go to the molecular level and create drugs. I'm not an expert, but that's what I could find. And that has a good use cases in gene therapy and vaccine. Now coming to their main product, they have a MAT 9001, which is an omega-3 fatty acid based drug. So basically in cardiovascular patients, their lipid profile is their main area of concern, and they need to remove those better, make their lipid profile better. And one of the ways you do is using a processed omega-3 fatty acids. And I have seen another company, Amarin, with the stock symbol AMRM, that I know about, and that's how I could relate to them. So they have and their the judgment went against them because they wanted to kind of file for a patent for that. That patent is still in kind of judiciary. So that kind of thing can happen here as well for the MTNB, and anybody probably could make this omega T fatty acid based solution for cardiovascular diseases. They are doing FDA trials, which may or may not be meaningful, because if others can also make it and they don't have any IP for that, there's not much value into this. But still, if they can have a very good marketing, they can sell it kind of more like a generic drug along with the other companies, and then they can get some revenue. And we do not have any revenue for that. It's going to take some time. Then they will have to put their sales team, they will have to go to the doctor, they will have to present their case that why their omega-3 fatty acid based solution is better than the other ones. And I do not see much hope in this one. But coming to the next one, this MAC 2203, what I could understand is that if you have some kind of immunosuppressant, either through HIV or using some medicine, you could be using medicine that could suppress your immunity. In that case, it's very hard for your body to fight against fungal disease. And the current solution for the fungal diseases is a medicine that's done oral intravenous, and that's called amphotericin B. The problem with that is that it can affect your kidney or other places. So they have come up with, using their LNC technology, an oral therapy that will have less adverse effects compared to the existing solutions. And they are in the phase 2 of the trial. And if that goes successful, phase 3, I think phase 4, and if they get the FDA approval, then that looks very promising. And they have funding from National Institute of Health that can pump some of, I think some of their money comes from NIH, or I don't know, in terms of other things as well. So that it looks very promising to me, but again, it's a time-taking process. Once they get the approval, they need to put up their marketing team, their sales team, to be able to sell those medicines. But if for some reasons, because it's a randomized trial, it's always possible that the results are not as clear, so they may or may not get this FDA approval as well. So we look for the FDA approval for MAC 2203 and any kind of the news over there. Now, MAC 2501 is another drug-resistant antibacterial, and they are used for non-tuberculosis mycobacterium to tuberculosis bacteria and things like that. That, I believe, is a number of other competitors would be doing this drug-resistant antibacterial thing, and that, I believe, is a competitive area where they may or may not get success. It's too early, it's still in phase 1, and then they will have to work against it. The other risk area I see is that the team of the researchers, I find very few of them, and I still have to dig down on it. So if those researchers, they leave the company, I believe the company will maybe in the problem, or they probably need more research fellows to keep working on whatever drug therapy they are using and keep working on this. So this is in overall my view of this thing. I am not a doctor or competent enough to comment on these things. These are just my own kind of interpretation, which may be completely wrong, or my interpretation of their financial could also be wrong, but that is just based upon whatever existing information I have, and I may have interpreted it incorrectly. So don't take it my whatever expressions for either medical or financial expertise. So with that being said, from the stock market perspective, I believe that in a small quantity, this is something you can buy and then keep buying more for example, 83 cents, and then buy more if it goes under like 63 cents. But at the same time, be prepared that all the money that you invest here could go just bankrupt, and then you could lose all of your money. Thank you.